Children enrolled in school in Ottawa must be vaccinated against 8 or 9 diseases, depending on when they were born, including tetanus, polio, measles, and mumps. Joining me now is Ottawa's Medical Officer of Health, Dr. Trevor Arneson. Thank you very much for coming on the show this morning.
Thanks for having me.
Good morning. Okay, so what is the actual risk of suspension here?
Yeah, so it's people in the 7-year-old and 17-year-old age cohorts. Those are two key time points or milestones for immunization. And we've been sending out notices since the fall about the need to get the records up to date. And we're sending out second notices now. And what happens is if there's no response to the second notice after 5 weeks, then the child in those two age cohorts will be suspended from school until the records are updated.
So if you do vaccinate your child and you want to update his or her vaccination records, how is that done? What's the process?
Yeah, so it's healthcare providers, primary care providers that deliver the routine immunizations in childhood generally. So that's typically family doctors, nurse practitioners, sometimes pediatricians. There may be an option to return to the provider who gave some of the routine immunizations for a lot of people. That's the first stop to go to. The next option, if you don't have a primary care provider, is to consider some of the Ottawa public health options. We're working with CHEO Kids Come First to run a community clinic to update children around who are out of date with their vaccines. And we also have neighborhood health and wellness hubs, which are around the city in areas where people have less access to primary care, and they can get these vaccines updated. An important thing to note, though, is you cannot get these vaccines at pharmacies.
Okay. What should a parent do if they're behind in the vaccination? What's the first thing they should do?
Yeah, the most important thing what we deal with the most is the records, right? So the records are really important. We use a yellow card system in Ontario, and we have for decades. But many people might not know where that record is. So the important thing is to see if you can find whatever records you can of your child's immunizations, because they may in fact be up to date. And if you have any questions at all about the process or reporting, you can go to parentinginottawa.ca/immunization. I think you showed it on the screen there. That's a really helpful website which directs people on how to report, what exactly they can what they need to do, and where they can go to get the immunizations that may be missing.
What happens if a parent is facing some sort of barriers actually attaining those vaccinations?
Yeah, so I mean, that's why we've started a lot of these programs with CHEO Kids Come First and the neighborhood health and wellness hubs, really trying to support people. I think the suspension is really a last resort. It's outlined in the law that we're following, the Immunization School People's Act, but public health does not want to suspend children. We're encouraging anyone with any barriers to reach out to us, and we can make arrangements and help people get vaccinated.
Okay, and that website that you alluded to, Parenting in Ottawa, what other information is available there?
Yeah, so there's a lot of information about the diseases themselves as well, and why vaccination is so important. I think sometimes, in all of this, we forget that in this reporting, we forget that it's actually, these diseases are quite concerning. We're seeing measles cases around the world. We're seeing the potential for exposure in Ontario. The reason we need to get these up to date is so that we know in the event of an outbreak or a case here in Ottawa, which children in school are vaccinated, and to ensure high coverage levels so that we can prevent outbreaks.
You can go to ottawapublichealth.ca for more information. Ottawa Medical Officer of Health, Dr. Trevor Arneson, thank you very much for coming by this morning. Appreciate it.
Thank you.
Thank you.